Welcome to Sex Care is Self-Care, a conversation on women's sexual health, brought to you by the She Plus Foundation. I'm your host, Patty Brisben. I'm coming to you with two really super special guests today, and they're members of the She Plus Foundation Medical Advisory Board, Karen Connor and Dr. Stan Althof. You both have been previous guests on our podcast, but for the listeners who are brand new out there today, tuning in for the first time, Karen, can we start with you? Can you tell them what you do on a daily basis, and who do you see?
Oh, fantastic. I'd love to. My name is Karen Connor, and I have my doctorate in physical therapy. I've been a physical therapist now for about 20 years. And early into my career, I just had this feeling that women's health is where I really wanted to be, and pelvic health in particular. I do a variety of things. I can treat any orthopedic concern from neck pain, back pain, foot pain, but my love and passion is absolutely the pelvic floor because I do believe the pelvic floor and its myriad of possible dysfunctions, including incontinence, pain with sex, anorgasmia, um, are a lot of times there are orthopedic drivers to it. And it continues to fascinate me. I continue to learn so much from my patients. So on an average day, I'm seeing mostly women, but some men with some form of pelvic floor dysfunction. And I love it. I love it to this day. It makes me excited to get up in the morning.
There you go. Stan?
So I'm Stan Althof. I'm a clinical psychologist, and I was a professor at Case Western Reserve's medical school for many years. I'm now an emeritus professor, and what I do day in and day out is I have a clinical practice. I'm the executive director of the Center for Marital and Sexual Health of South Florida. In addition to seeing patients, I do a fair amount of research. So I publish on some of the sexual problems that I see in women and men. And formerly, I've been president of the International Society for Women's Sexual Health and the Society for Sex Therapy and Research. So I'm slowing down as I get older, but I continue loving seeing patients and writing papers. So life is good here for me in Florida.
You know what? Thank you so much, both of you, for everything that you do and all that you give back to women. We definitely need more just like yourselves. And I'm so proud that you sat on the She Plus Foundation board. Sometimes I pinch myself and go, I am a lucky girl. I really am. So thank you so much.
Well, it goes both ways, Patty. I consider myself extremely lucky to be aligned with the She Plus Foundation and the mission of the foundation. It's an incredible place to be associated with.
Thank you so much.
Ditto for me. It certainly is. And you have a wonderful medical board, and the fact that there are grants available to people, it's a tremendous thing.
Thank you. And we're going to continue this. And I'm hoping that things are going to get better. I never thought. I have 14 grandchildren. Many of them are girls. The oldest one is 24, and the youngest one is 5. But I'll tell you what really bothers me right now is that I had more rights than any of them have as of right now. And that bothers me. I don't find it fair. I find it hard to wake up in the morning and think about that. Could you speak on how your practice has changed in the last several months with all these changes?
So for me, Patty and Karen, I think the word chaos comes into it. I think people don't know what to do moving forward in women's sexual health. They're not sure which procedures are covered, which direction to go. They're not sure. And let me be more specific, depending on the different states or even counties, whether you can move forward with abortions, whether you can even think about abortions, whether you can deal with IVF, whether you can have certain kind of gender affirming surgery, receive hormones, or what's covered for people who are under certain insurance plans like Medicare. So I think that the word chaos has been introduced to a medical system that was already complicated before we started.
That's a great
I would
word.
completely agree with that. I think chaos is a perfect word to describe what's happening now. I know I'm seeing in my patients levels, unprecedented levels of economic anxiety in terms of spending money. I probably have this conversation 2 to 3 times a week with people. I had a woman who canceled her first appointment with me because she thought her husband might be getting laid off because he was a federal worker, and so they're tightening their belts. So when people aren't spending money on their health and taking care of themselves, you're going to see a rise in illness, and you're going to see a rise in more and put more burden on an already overburdened healthcare system. I think it is terrifying, Patty. I agree with you, to watch us walk back rights that have been continually defended and voted on for women, but there's always the undercut. Like I know in Ohio, we just passed issue 1 a couple years ago, which made abortion was supposed to make it lawful, and they have worked to put something in the legislature every single election cycle since then to make issue 1 less powerful for women. And that is terrifying to see when the majority no longer speaks, that it's a small minority of people who actively vote against women's health care that have the microphone, so to say.
Yeah. I mean, with everything that you're seeing in the headlines right now, and you're seeing online and just all over the place, is there any glimmers of hope that you're clinging to right now?
For
Well,
me, go ahead, Stan. I'm sorry.
no, please go ahead, Karen.
I was going to say, what brings me hope is the rise of community. I think you're seeing a lot more people get very involved on the local level.
Mm-hmm.
I think more people are getting angry, as they should be, and you're starting to see people wanting to have their voice heard. So I look around at community a lot and try to find some hope from there.
Thank you.
Well, I think we do have hope. I'm more into thinking about how this is, it's darkest before the dawn, and that people are being mobilized. But I also think in terms of cycles. And I think we're sort of, I hope, at the bottom of a cycle, and that things will get better from here. There will be less chaos, more clarity, more people's rights will be restored, that people will be allowed to practice in an unburdened way, patients can seek care, and that all of this will be less politicized and more directed to taking good care of our patients.
Thank you. Um, for the average patient, and I know, Karen, you kind of touch base on this a little bit with somebody that just came to your office that missed their first appointment. How are changes in the administration making that is going to impact their health care?
I think ultimately it's going to become harder on the consumer. Just historically with this administration in the past, I think the emphasis will be on profit over person. So I think we're going to continue to see cuts in covered services and making it much harder for patients to get care. There's this doctor on Instagram, I'm not sure, her name is out of my head for a minute, who talked about having to leave a surgery in the middle of a breast reconstruction surgery because the insurance company demanded they speak to her right then and there to see if her patient was going to stay the night in a hospital after a surgery. And she posted it on Instagram. And since then, the insurance company is suing her for saying that and saying it didn't happen. So I think you're going to see more barriers put up in front of doctors and healthcare providers to get very basic services covered. And by the way, in full transparency, she had already gotten this pre-approved by the insurance company for the overnight stay. But they pulled her out of surgery. She had to re-scrub in to do it. And unfortunately, I think that's how it's going to keep going for now.
Mm-hmm. I believe that.
I think when you look at certain populations, for instance, the Veterans Administration has let go of senior counselors, and it was already overburdened with people who really, really needed care. So all of our people who have served the country are being less served, getting less care, and I'm particularly looking at the mental health needs of this population. And again, if you look at the population with Medicare, you're seeing cuts, all the time, or a lack of clarity as to what services are being offered to these patients that they can receive. And there are cuts overall in programs. So that to me right now, it's very difficult to be a patient or a consumer because there's a reduction in what they can get and a lack of clarity in what they can receive.
I agree. And as an out-of-network practitioner, meaning I don't accept insurance directly, but most insurances have out-of-network benefits, I tell every patient who's going to apply for them, I'm like, please do just know that the standard of care currently is 3 denials. It doesn't matter. They're just going to deny you 3 times because they're going to try and exhaust you from being reimbursed. That's one of the ways that they make money.
I've been through that myself.
Yeah.
So yeah, it's happened. And you just have to stay on top of it. You have to be your own advocate.
100%. And it's hard.
Yeah.
It's not easy on purpose.
Yeah. Karen, you're a pelvic floor therapist. For our audience out there listening right now, just exactly what do you do and why do you do this?
Well, so a pelvic floor therapist can see a whole spectrum of issues. So some of the most common diagnoses I see are pain with sex, pain with sitting. Pain is probably one of my specialties.
Mm-hmm.
I also treat people for incontinence. I treat people through the perimenopausal transition because we do get different demands on our body, and there are some changes that happen that as women we should be aware of. So when someone comes to see me as a pelvic floor therapist, what I would want to assure everyone is it's not straight for the vagina and here we go. The pelvic floor is part of a dynamic system. It's part of the hips, the glutes, it stabilizes the low back. It helps provide stability through the lower body. So we look at you as a whole person. We look at to see how the pieces and parts are put together and how they're working, because something as simple as ankle stiffness can actually impact how the pelvic floor receives and transmits force through the pelvis. And, if you think of a stiff ankle and you're walking, it may not be something that develops in 6 months, but it might be something that develops in a year. So we look at you orthopedically first, head to toe, and then we do an internal assessment typically, but always with a patient's consent and full understanding of what I'm doing and why. And we'll look at it just because it's muscle. It's like any other muscle in the body. It should be able to contract. It should be able to relax. And many times, just like we can get neck pain, back pain, hip pain, you can get spasms in your pelvic floor that with direct treatment can be relieved. And then we make sure we address the underlying issue that may have contributed to them. So there's a lot that I do. I think that's why I still love it. I still get excited about it. But the most important thing anybody who's seeing a pelvic floor therapist should know is it is your body and your right. You have an active voice in how that treatment goes, and don't ever feel like you should participate in something you're not comfortable with.
There you go. Do you think, this is kind of an off question, but if somebody's seeking out their physician and they don't even bring up a pelvic floor therapist, is this a great question for them to ask their doctor? Do you think a pelvic floor therapist might help me along this journey?
100%. I think that the mutual dialogue is very important. I know when I talked to my former primary care physician a few years ago, and I said, I think I might be starting to go through perimenopause. And he said, no, you're too young. And I said, no, I'm not, according to research. And then we started talking and he asked what I did, and I'm a pelvic floor therapist. And he said what I think is one of the biggest misunderstandings of women in pelvic floor. He said, oh, so you treat 80-year-olds who leak. Well, the poor man started to back out of the room as I delivered a 10-minute lecture on exactly what I treat and why he should be sending me a lot more patients. I also found a different doctor after that point, but that's okay.
Good for you. Good for you. You know, I've got to tell you, last year when you called and said, "Hey, I'm opening up my own practice," I was so excited for you. And I still am excited for you because I think that what you do is absolutely amazing. But with everything happening right now in this world, how has this impacted you and your patients? I know it's scary for the foundation right now for us. I can't imagine for somebody who's starting a new business how this is going to be for them. Can you elaborate on this?
Yes, I think I'm going to go back to Stan's word of chaos as I think a good one. Again, the economic anxiety is being felt strongly. And again, people are, and I think especially as women, we are vulnerable to putting ourselves last. So when we think of something in terms of health, and especially things like painful sex, many women I've spoken with through the years are just like, well, it's just pain. I mean, I'll be okay. No, it's not okay. Your pain and your health matter. For myself personally, again, I felt like I was at a place where I had to step away from the current healthcare system. My employer was wonderful, and this is not a diss on them because are great. But the burden that's being placed on practitioners to see more people in less time is real. And when you do that year after year after year, it takes a toll on your mental health. And I think healthcare in general has to have a reckoning with how they keep talented practitioners at every level while balancing the need to, break even and pay people. My patients who have followed me from my former job love my new setting. They note that I am more present, that I'm not watching the clock. I have more time. They can text me. I can text them back. I can get them in within a very reasonable time frame and offer really a concierge level service of what do you need from me, not what will your insurance pay for me to do to you.
That's amazing. Thank you for sharing that with us. Stan, you're really heavily involved in the research community. How do you see the conversation nationally changing about research at this moment?
Yeah, at this moment, again, things are chaotic, but they're also very bleak. For instance, I was at a meeting this past weekend in Philadelphia, and I heard that a fellow who's in charge of an HIV clinic, his grant was terminated, and he employs 100 people. So he had to let 100 people who had worked for him for years, they lost their jobs. The research that he was involved in came to a crashing halt. So I think that there are many research projects that are suddenly being terminated or stopped or are in danger. I also think it's very tricky. At this meeting, we had a number of Canadian citizens, and they came. Half of the Canadians didn't come because of the political climate, and these people were told, wipe your computers, be very careful. And they were actually very frightened. I never heard the term "when we cross the border" used so much. It was like sounding like a border you're going into Russia, as opposed to our good friends in Canada, where we go back and forth and back and forth, that they were very frightened. So I think the research community right now is justifiably paranoid and worried about continuation of funding, what they're allowed to do, the restrictions being placed on them, and of course, continued employment for people that work for them. So it's a bit bleak at the very moment.
Okay, all good news.
Stan, can I ask Stan a quick question?
Yes.
Stan, do you think the pause on research, and one of my big concerns is you're going to start to see a lot of our amazing medical talent go overseas or go next door because it's safer and there might be funding. I know France is offering medical and science visas to people that want to move to France.
Yeah. Again, I'm thinking this is probably more temporary than permanent, and that things will cycle back to a more normal kind of climate for all of us. Or maybe I'm just in eternal hope that things will get better for all of us.
We all have to choose better. That our choices have to be better, and we have to use our voices, and we have to stand up for what we believe in. Okay, Stan, this is a question for you right now. How can we get more of the schools using this updated research?
So sex is a bad word in
Yeah.
education right now, right?
Mm-hmm.
Sex is a terrible word, gender's a terrible word, you know, and so things that reflect sexual research, whether it has to do with pain, whether it has to do with fertility, all of these things, whether it has to do with sexually transmitted diseases, people are afraid. I mean, just here at Palm Beach County, they took away all the diversity, inclusion, and so on grants. They now, books can't be in the library. You can't include things in curriculum. I know you asked about medical school, but it's more than medical
Mm-hmm.
school. We look at our public school education, which is where we start. So kids can't get sex education appropriately and learn about things in a healthy way, in a way that's supportive. And again, that goes all the way through. Sex is a bad word. We'd rather do something else in surgery than learn about sex or pain or reproduction.
It makes me so sad because people go right to the act and they don't think about health. And sexual health is general health. Let's get real. I've had people offer me money, checks, nice, healthy, hefty checks, just to take the word sexual out of health and what we're about. And I refuse. I'm not doing that because I want my granddaughters and generations thereafter to know it's worth fighting for. Stand up, use your voice, because nobody else is going to advocate for you, only you. All right, I'm passionate. I know that you guys are passionate. How do you stay motivated to keep going when the funding is being impacted? What do you do on a daily basis? How do you keep yourself going?
I think my pleasure has always been listening to people's stories and helping them navigate their difficult circumstances. So to me, I know I'm doing a good deed. It feels good, the right thing. I know they sound like, just silly proverbs, metaphors, but they are useful to keep me going and bring me into the office. The same with research. I think, well, this is an interesting question. I'd like to find out the answer.
Yeah.
And so that's why we do the research that we do. So, that's my personal way of looking at this, is just put one foot in front of the other and keep doing what you're doing. And you need, as you keep saying, Patty, you need your voice. You need to be heard. We have our professional organizations. We have you and others that are certainly beginning to give things a voice that haven't had the voice that they've needed.
Thank you. Thank you.
I agree. I would also say, and is being vocal at all levels of the government. So I get some hope and definitely some joy from calling my state reps and my government reps and letting them know my opinions on things that matter to me, because they have to log every call that is received. So I like to think that hopefully I'm helping tip the scale more in the favor of sexual health, reproductive freedoms, um, LGBTQIA plus
Yeah.
care, things I so genuinely care about. And then I make it a point to never stop talking about it. I'm a delight at dinner parties, as I'm sure I've said before, because I will talk about sex and vaginas at the drop of a hat. Because I'm with you, Patty, we need to normalize these conversations because it's health. And what we know from previous research, like on abstinence research, is keeping quiet about it doesn't work. It just creates more problems in the long run.
That's why we keep getting asked to join these parties and dinners and stuff. Yeah.
That's
We're
I
not
have one friend
afraid.
who literally went, "Oh my God, here she goes." And I was like,
No.
"Stand back."
How does the average person supposed to navigate all of these changes? What kind of advice would you give to them?
I'd
My
start with the economics, and look at the person purchasing insurance, which tends to drive things. They need to become increasingly sophisticated, that the least expensive insurance policy, may not cover Karen. It may have an exclusion about sexual health and not cover me. Um, and so I think people need to think about, what is it that I need? What kind of drugs am I taking? What's covered? What about the illnesses that I have? And if I have a sexual health problem or concern, will my policy cover a therapist, whether it's a pelvic floor therapist or a psychotherapist, to help me with this? So I think people need to ask a lot more questions, and it's a bigger burden because you need to become more educated. Usually we look at the policy, gee, this seems good, this isn't too expensive, what's my copay? But we need to go
Mhm.
further than that. And patients need to think about what will be best for me and my family.
There you go.
I agree. I also think even just talking, like you said, Stan, about the medical side, as physical therapists, when we're coding, so we have to provide for anybody out there what's known as a diagnosis code, to when they're billing insurance companies. Insurance companies, for the most part, will not cover any code that has to do with sexual health. So dyspareunia, which is the fancy way of saying painful sex, is not something as a pelvic floor PT I typically put as my diagnosis code because I know um, it won't get covered for the patient. So those are things I think we need to become more aware about and be less accommodating to the insurance companies that are making these decisions for us. I would also go back to say is be politically active, make your voice heard, because silence won't help anyone. And if you're passionate about something, let that be known. And listen to your body and invest in your health and wellness, because the best way I think to navigate the system right now is to stay as healthy as humanly possible.
There you go. Thank you. Um, Dr. Althoff, last time we spoke, you mentioned, I'm good. If I screw it up, I'm sorry. Biopsychosocial. And it's incredibly important to women's health. Could you speak on this here? And if I screwed it up, fix it.
Right. Didn't no need to fix anything. So to me, this can come down to the idea of everybody stays in their own lanes. And it's the reason that Karen was saying, for instance, about being referred to as a pelvic floor therapist. So when you go, if you're a woman or a man, but in this case, a woman, and you go to a physician, you expect a medical diagnosis because that's why you went in. And it's not likely that the physician is going to think about psychological or relational issues or even cultural issues
Mhm.
that may be at play here. So that, it's sort of the physician and is trained to, she or he will stay in that lane. Now, not to bring it over to psychology for a minute, it's the same idea. So the woman walks into a psychologist's office and she's there because she thinks this is probably, quote, in my head, as people would put it, or this is, a psychological concern. And many of the people aren't skilled or don't know a lot about the relationship to the body. And so that what I keep advocating for is the biopsychosocial approach, that we look at under every rock very carefully. We look at the biology, we look at illnesses, we look at medications, we look at surgeries. In psychology, we look for depression, anxiety, stress, trauma, all the things that could interfere. We want to look at that relationship that the woman is in and past relationships. And you need to be very good at bringing these together. And unfortunately, many of us stay in our own lanes and don't integrate the woman's care or think beyond what's in front of us. And so that's, to me, what's been missing all along. And I'm a strong advocate for having clinics that include the medical, psychological, pelvic floor. We don't have enough of these integrated clinics that would really be helpful to the woman. And so that's really, again, that's where I give my voice, is when I teach, is to, get out of your lane, think about more than that. Because yes, there may be a medical problem, but a medical problem may mean there's a psychological response, or a psychological problem may relate to a medical problem. So I think we need to be very clear about moving over across boundaries.
There you go. I like that. Be all over every lane. Okay, I always ask this question because I want to make sure that there isn't anything that I've forgotten. So, do any of you have something that I might have missed question-wise that you would like to address before we end the podcast?
I don't, Patty. I want to thank you for inviting us onto this. And I hope it's helpful to people. I think we're in a very difficult time, and we need to do everything we can to keep hope alive and move it forward.
Thank you.
I think you said that beautifully, Dr. Althof. And I would just add again to anybody listening to this is that you matter. Your health matters, your mental health matters, your physical health matters. It may sometimes feel like nobody is listening or caring, but there's so many people out there who care about you, and make sure to protect yourself.
Thank you. You both are absolutely amazing. You've brought so much to the audience here today, and I'm grateful that you're in my life. So thank you. If you liked what you heard today, please rate and subscribe to our podcast. For more information on the She Plus Foundation, you can go to www.sheplusfoundation.com. Remember, sex care is self-care, and sexual health matters. Thank you.